We are at the policy update segment of the conference. Here we're going to give you some updates on where we are with some of the key policies that MPHA is supporting at the state level. And we really wanted to share ways that everyone can plug into these efforts. I assume everyone on this call knew before that policy can have a tremendous impact on your life. And I know that we're all feeling that personally and deeply over these last 10 months with the seismic policy shifts that we've been feeling from the federal government. Um, at the same time, we are grateful for leadership and in Massachusetts, and that means that we can be pushing forward on public health policies so we not only protect against what's coming at us at the national level, but we continue to move forward on health equity, and that is MPHA's commitment now and forever. And with that, we're going to shift into the policy priorities that MPHA is supporting. MPHA sets our policy agenda every 2 years in partnership with our policy council and our board and the staff at MPHA. And we set it for the legislative cycle. So we are approaching the second year of the legislative session and the second year of this agenda that we set last year. Our overall goal with our policy priorities is to eliminate all forms of structural racism and structural inequity that affect health, including poverty, sexism, ageism, homophobia, transphobia, ableism, and xenophobia, among others. Those were our priorities in 2024. Those have been our principles for many years, and these things are not changing. If anything, we're doubling down. Within that, we've identified 6 policy priority areas. I think as everyone on this call knows, public health is everything. Everything is public health, and that is why we work on so many different issues that impact health. In public health infrastructure, we seek strong governmental systems that provide services that prevent disease and illness and ensure safe communities regardless of race, income, or zip code. On housing justice, we are pushing for inclusive communities where all residents can find safe, accessible, stable, affordable housing, and where residents who have been harmed by racist housing policies and practices have decision-making power. With respect to transportation justice, we are working towards a well-integrated statewide public transit system that gets all residents, particularly people living in regional transit authority areas, where they need to go. We are also fighting for sustainable food systems. We are fighting for an equitable and resilient food system that ensures that all communities have access to healthy and affordable food. Environmental justice is another priority area for us where we are working towards climate policy that prevents and mitigates the public health impacts of environmental racism, particularly in low-income communities, communities of color, and English as an additional language households. And finally, we are seeking to advance equity through healthcare. And for us, that means a healthcare system that leverages its power and resources to achieve health equity through legislation and regulation, addressing health-related social needs and promoting equity in healthcare. And Kate dropped the link to our policy priorities, where you can see our priorities and very specifically, many of the bills that we are working on under each of these categories. We did want to give you some updates on some of the particular bills and initiatives that we're working on that are right in front of us right now and ways that you can plug in. And I'll turn it to Kate to kick us off.
Thanks, Omi. We'll dive right in. So, as Omi mentioned earlier, while our DPH colleagues were still with us on screen, we had a landmark legislative win last November, actually during this conference, which was really outstanding timing, when SAFE 2.0 was signed into law by Governor Healy. At this annual conference, we would love to see the chat filled with all of the excitement and recognition that FEAT deserves. You can see a timeline of that bill's path to law on your screen, and also just want to acknowledge the long journey that it took to get there with so much effort from many of the people that are with us today. But as so many who came before me have said already, the fight isn't over. In fact, we are far from it. Although SAFE 2.0 has passed, we continue to work diligently to raise visibility for the local public health workforce and make sure the voices of those working hard every day in our communities are kept front and center. In October, we hosted Public Health Excellence Day at the State House, and we were really amazed by the strong show of support, not only from our workforce, but from our local and state electeds, partners at DPH, and so many other valuable allies. One key message that was heard from all of our speakers that day rang loud and clear, and that's that we need the voices of local public health to be involved now more than ever if we're going to maintain the progress we've made and keep it moving forward. And so that's why MPHA is hosting a year-long Send an Email, Educate a Legislator campaign, which started just a few months ago in September and is designed to give legislators across the Commonwealth a peek into the daily lives of our local public health workers. We know that small collective efforts can add up to make a big difference. So if you're interested to participate or know someone who would be, click the link that Oami has put in the chat now. Thank you so much.
Related to this advocacy campaign, and Kate is running a beautiful public education campaign. So if you are someone who cannot lobby or have professional restrictions on that, this is a public education way to plug into making sure that local public health infrastructure is protected here in Massachusetts. We are all, I think, bracing for what we know is going to be a tough fiscal year in the fiscal year 2027 state budget, which is coming up. It's going to drop on January 28th from the governor. With all of the federal cuts and funding uncertainty that we are living through, this budget cycle is going to be all hands on deck to make sure that public health programs that support people in Massachusetts continue to be funded at the appropriate levels. MPHA advocates on a lot of different parts of the budget because so much of state funding impacts public health. But here are just three top line priorities that we wanted to share today. As we've already talked about, the budget process kicks off in about 2 months, so we don't have an action yet for you to take, but please stay connected to our email list so that when the actions do come out, you're ready to take action. We are going to be fighting for increased funding for local and regional boards of health to make sure that our local public health infrastructure continues to have the resources it needs to deliver vaccines, to inspect restaurants, and make sure that our waterways are delivering clean and healthy water, and so much more. We are also going to be looking to maintain investments in regional transit authorities. Stuart spoke a little bit to this in the previous segment. MPHA, along with our partners at the RTA Advocates Coalition, or RTAC, which we co-convene with T4Mass. I saw Raylan in the chat. We have seen enormous investments as a result of the Fair Share Amendment and Fair Share funds in regional transit authorities. We're seeing increased service on nights and weekends, and this is having a real impact in communities all over the state. We want to continue that progress and make sure that these agencies get the funding they need to deliver public transit services all across the state. I know this is top of mind for everyone right now, given what we just went through with SNAP. And MPHA is going to continue to prioritize full funding for programs that support healthy food access. That includes SNAP, but also other programs like HIP, the Healthy Incentives Program, and the Massachusetts Food Trust Program, which is a public-private partnership that allows healthy retailers to open in communities that are underserved. We also know that cuts are going to be on the table for every program, and so it's really important that folks show up at rallies, show up to the legislature, go and vote, and talk to your legislators all the time about the impacts you're seeing in the community and what your priorities are. So stay tuned for more.
Thanks so much, Omi. Money is definitely on everyone's minds these days. And so that's why we wanted to include a policy update about the corporate fair share campaign, which hopefully many of you are familiar with. And if not, this is a great opportunity to learn. It's important that you do. We know that massive budget cuts are being made at the federal level. Omi mentioned many of them. They're going to directly impact our Massachusetts communities. And we can prevent some of that damage being felt to our communities by stopping corporate offshore tax dodging and making billionaire global corporations pay their fair share in state taxes. Um, we have a link going in the chat where you can email your legislators today and urge them to support protecting our care with corporate fair share.
Thanks, Kate. And folks, please take these actions. This is one of our priority campaigns this year, as Kate said, because we know funding is tight and Massachusetts needs to raise revenue. We've seen the promise of progressive revenue from the Fair Share Amendment, which is one of the only places in the budget that we're seeing increases because of that funding. And we need corporations to pay their fair share too. Um, we are all really scared about what's happening to immigrants in our state and also citizens who are being caught up in these ICE raids, the racial profiling, the masked agents wandering the streets of our communities and terrorizing our communities. This is leading to huge public health issues aside from just the trauma that people are experiencing and family separation. We know that people are afraid to send their kids to school. They're afraid to go to work. They're afraid to walk out the door. And these fears are not unfounded. We have heard horror stories of young people, kids who have been locked up in immigration detention here in Massachusetts, just because of the color of their skin, who are not even being charged with any crimes or any wrongdoing, but who are being torn away from their families and sent to inhumane conditions that no one should suffer through. And so we are doing everything we can to support our partners in the MPHA coalition. They have two actions going on right now that we hope everyone will take a minute to take. They have a petition that they are running to support the rights and inclusion of immigrants and refugee in Massachusetts policies. You can sign that right now. Kate's dropping the link in the chat. And we are also continuing to support the Safe Communities Act. This is legislation that has been around for many, many years, and is more urgent than ever that we pass this legislation. There's a hearing on this bill coming up. It's on Tuesday of next week at 11:30. So please sign up for the MPHA Coalition's action alerts so that you can find out how to raise your voice, how to come to the State House and tell your legislators that we need to be doing everything we can to protect immigrants in Massachusetts from this abhorrent attack from the federal government.
All right. Now moving on to housing. If you've lived in Massachusetts for any amount of time, you know that housing is an issue. And like all of the other topics that we've discussed today, we're feeling the squeeze now more than ever. That's why MPHA is supporting tenant-led coalition Homes for All Massachusetts efforts to stabilize rents and prevent displacement. The campaign, as we talked a little bit about earlier, chose to move rent control to a ballot measure, although there's still legislation that it's moving its way along through the State House too. And there's some difference between both the ballot and the legislation, and we're going to include some opportunities to plug into both tracks of the campaign. So on the legislation side, there's a hearing happening for the bill at the State House today. But the good news is that there are still other ways you can take action. Omi is going to drop a link in the chat now to HFA's Take Action page where you'll find phone call and email templates that you can make to support, that you can use to support the campaign. On the ballot side of things, there's still an opportunity to endorse the ballot question, and it's important to take note that even if you have endorsed the legislation, that this is a separate endorsement, so please make sure to still open the link and check it out. And Omi's going to put that one in the chat as well. Thanks so much, Omi.
Thanks, Kate. And so, as Kate said, the hearing is happening literally right now on rent control in the Housing Committee. This happens all the time. Every time we schedule an event, a priority of ours comes up in the State House. And so we know a lot of our housing justice partners are not on the call right now because they're there at that hearing. We are going to be submitting testimony in support of legislation that's under consideration. And MPHA has already endorsed the ballot initiative. They're collecting signatures right now to get on the ballot. We will know next month whether or not rent control makes it on the ballot. but I know the effort to collect signatures has been really big. I have signed a petition. I hope everyone else on the call has too. In fact, if you have signed on to the petition to get rent control on the ballot, please drop an emoji in the chat. Thanks so much for your engagement. And once we find out in December, hopefully we're going to get the good news that we're on the ballot. We are going to be um, figuring out the best way and letting folks know how you can plug in to convince your peers, your fellow voters, your roommates, your parents, whoever it is, to vote yes for rent control at the ballot in 2026. Um, so that's we're going to leave it there with the policy update because we could spend a lot more time. There's so much happening right now. One great way to stay abreast of all of the work that MPHA is doing and that our partners doing is to check your email. We have started an email action series called Resistance in Action. We send it out usually on Fridays. Sometimes it's weekly, depending on what's going on. We are trying to give updates about what we are working on and also share out actions because there is so much going on. There are so many actions that we can all take to resist what's happening at the federal level and move forward in Massachusetts. If you have actions that you think that we should know about, that you want us to spread to our list, please send them to us. We really want to hear from you about what you are working on, and we want to share that out. You can send an email to mpha@mapublichealth.org. We check that regularly, and we will include your actions as we are able to. Thank you all for the work that you're doing, whether it's work that MPHA is doing or not. We feel the love, we feel the partnership, and we are really grateful for all of your work and all of your support. Don't forget to donate to us. You are looking right now at the whole policy team at MPHA for these 4 months. We are doing a lot of work. Kate is absolutely killing it. And we just really appreciate all of this time.